We're hearing from hospitals around the country and state and local leaders around the country who are telling us that they're concerned that in a week, maybe 2 weeks, they might run out of beds, they might run out of ventilators. So how do you line those two things up this morning?
Well, we should always be listening to our frontline medical workers because they are the ones seeing what's happening on the ground. And what we're seeing in New York already is that people are so concerned about ventilators, intensive care unit beds, and these limited resources that they're thinking ahead and thinking about what would happen if I had to make the decision between 2, maybe 3 patients who need that same limited resource, that ventilator. Would I have to choose between the two? Can I share the supply in some way? And I agree, of course, with Dr. Birx that that's a situation that we should never have to be in. But that's what our frontline workers are facing. And I think that really underscores the need, the critical need at this moment for us to get resources to those hard hit areas like New York, but also to prepare everywhere else in the country because they may not be far behind. Louisiana and Michigan and many other states may not be far behind where New York is. And I don't think we can be blind to the reality of what could be.
And Dr. Gupta, we heard from the president last night questioning whether he really believed that New York City needed the 30,000 ventilators that Governor Cuomo says he needs. What is the need? Doesn't the federal government tell us how many ventilators we need and how many we have? Isn't there a discrepancy there?
I have been struck by this issue almost since the beginning, John. I mean, this idea that we have to wait until we're in crisis mode before we say, okay, now we need this thing. This is what preparedness is all about. And I should point out, Dr. Wen's a former Baltimore City Health Commissioner, so she had to make some of these decisions. And it's all about sort of trying to be ahead of the curve. First of all, the picture that we're seeing is behind the curve by definition, because it takes a while for someone to develop symptoms. It takes a while for them to get tested. So when you see these numbers go up, they reflect exposures 10 to 14 days ago, probably. So we now have good data on the ground. We're seeing, for example, what the doubling time is. So when they look at these doubling times, they can say, hey, based on what we're seeing here, if this doubling time maintains, that means we're going to double in 2 days, we're going to double again in 2 days after that, and so forth. Therefore, we need X number of ventilators. Right now, there's over 1,000 people who've died in this country. In 2 weeks' time, if the doubling time is 2 days, that turns into 128,000. So I'm just a little bit surprised that still at this stage when, John, you and I don't even know now, a few weeks ago we were asking about ventilators and we were told, really, we're not really focused on ventilators now. To still be saying that in some way is quite shocking. If I can, just for a second, John, just put up these full screens, show, okay, look at the numbers as how they're going up. And then I have these graphs that show basically how many beds would be necessary, how many ICU beds would be necessary, and how many ventilators would be necessary. And I can tell you for a moderate scenario, they said it might be some 64,000 ventilators. In a severe scenario, it could be 750,000 ventilators necessary in the country. So this idea, again, that that's the moderate scenario you're seeing on the screen. Yeah. And I specifically wanted to put up a more moderate scenario. We're clearly not in a moderate scenario right now. In a very severe scenario, you can see 2.9 million ICU beds necessary. So, John, yes, maybe we don't have the need right now, but we will. That's the whole point. We should be getting ready for this as opposed to saying, okay, now we need it because there's a bunch of patients who need ventilators. They don't have them.
It's about planning. It's about thinking ahead, which is something that I know you, Dr. Wen, have done for a living. I just want to also play for you. There's a great town hall last night that Sanjay was part of with Dr. Anthony Fauci, where the lead infectious disease doctor in the country was trying to explain what the president was saying when he hopes to open up parts of the country by Easter. Listen to what Dr. Fauci said.
I think that the president was trying to do, he was making an aspirational projection to give people some hope, but he's listening to us when we say we really got to reevaluate it in real time, and any decision we make has to be based on the data.
So, Dr. Wen, I know you're looking at the data. What is the data telling you? And as you are trying to reassess this real time, what do you see?
I see data that's incomplete. We have already reached this grim milestone that you mentioned at the beginning, John, about the U.S. reaching the highest number of cases in the world, but that's the highest number of cases that we know of. And we're severely limited by lack of testing, so we actually don't know the true caseload in the U.S. We also don't know if the places that we're identifying as hotspots are the only hotspots. There may well be other communities that have very rapidly rising number of cases that we just have not yet identified because of lack of testing. So I agree, of course, with Dr. Fauci that, as he was saying yesterday, that the virus should be what determines the dates and the timeline. But we also need to have the data to make those decisions. And that's what the government should be working on. We should be working on getting capacity for testing to get those data. We should be strengthening our healthcare system. And then when we have that under control, that's when we begin setting out criteria for how we can roll back restrictions. Doing so before that is premature and extremely dangerous.
Yeah, we saw concerns of hotspots now in Wayne County, which is Detroit, Cook County, which is Chicago. I'm going to jump around the world, Sanjay, and talk about a city that I know you've been looking at very closely, which is Hong Kong, which had its highest reported number of cases overnight, more than 500 reported cases. Now, this was a city that I think thought it had seen the worst of this, and it started to come back to life. So when I saw that alert this morning, the highest number of cases reported, it jumped out at me. What do you see there?
Yeah, I mean, look, this was a place that you and I talked about a few weeks ago, holding it up as a model, saying, look, this is an example of the impact of these social distancing measures, and they're doing a pretty good job keeping the case numbers low. You sort of take your foot off the pedal for a bit and think, you know, we're good. And you're suddenly reminded of just how quickly things can change. Just within a few days, the case numbers doubled, and then, as you point out, they've had this other surge again. So I think, you know, what I took away from that, I guess not surprising, but a good reminder, is that not only do we have to do these things, we have to do them diligently. I'm talking about the mitigation measures, the stay-at-home measures, things like that. So it's you know. We have all this sort of historical data. We go back, a lot of people show you know, models of the 1918 Spanish flu, things like that. What is striking to me now, John, is we have real-world data. We can look around the world and see what's happening there. Spain should have been paying attention to what was happening in Italy. They thought, well, there's an ocean, you know, I mean, of course we're going to be okay. That's not how viruses work. We should have been paying attention to other countries around the world, not just looking at other historical data, although any of that data would have suggested that we have acted earlier than we did. But this is a lesson for Hong Kong, and again, we should be paying attention.
Let's hope we are. Dr. Sanjay Gupta, Dr. Leana Wen, thank you very much for being with us this morning.
Yeah, thank you.
Detroit, as we just mentioned, is now an emerging